So, you've just gotten the news from your doctor. You have an enlarged prostate. Maybe the diagnosis itself wasn't a huge shock, especially if you've been dealing with the frustrating symptoms for a while now. The constant trips to the bathroom, the feeling that you never fully empty your bladder, the nighttime interruptions that rob you of a good night's sleep. And now you're faced with a choice. The doctor might be talking about surgery or a lifetime of medications, and a part of you is hesitant. You're worried about the side effects, the idea of a procedure, or maybe you just believe there has to be a more natural way to manage this. You're looking for another option, a way to take back control. If that sounds like you, then you are in exactly the right place. Welcome, it's Dr. Evelyn Hartwell here, and I'm really glad you found this video. Today, we're going to talk about exactly that. How you can manage the symptoms of what we call benign prostatic hyperplasia, or BPH, without immediately turning to medication. And listen, even if you're a younger man and this isn't on your radar yet, I encourage you to stick around. This information is incredibly valuable for you too. Think of it as preventative maintenance for your future self, because the reality is a vast majority of us men will experience an enlarged prostate as we age. The key is to manage it so that it doesn't cause us any symptoms. For many men, once the diagnosis is made and the symptoms become a daily struggle, the conversation quickly turns to surgery or drugs. And I understand the hesitation, fear of the unknown, or not wanting to deal with unwanted side effects is a completely valid concern. So with that in mind, let's dive into some powerful, practical strategies you can start implementing today. The very first and perhaps most fundamental step you can take is to change how you think about water. You need to start drinking at least 1.5 to 2 liters of good, clean water spread throughout the day. Now, don't get caught up in marketing for special alkaline or mineral-infused waters. The most important thing isn't the type of water, but the timing and consistency. Start first thing in the morning and continue taking small sips or having small glasses of water intermittently. The goal is to stay consistently hydrated. I know what some of you might be thinking. Doctor, I already have to pee all the time. Won't drinking more water just make it worse? It's a logical question, but it works in a counterintuitive way. When you're dehydrated, your urine becomes highly concentrated. This concentrated, dark yellow urine is incredibly irritating to the lining of your bladder and the prostate itself. This irritation is what sends those urgent signals to your brain, making you feel like you have to go right now, even if your bladder isn't full. By staying well hydrated, you dilute your urine, making it less irritating. Over time, this can actually help calm the bladder down and reduce that constant sense of urgency. The key, however, is to front-load your hydration. And this brings us to our second, critically important piece of advice. This tip goes hand in hand with the first. Try to stop drinking all liquids after 5 p.m. This sounds so simple, but believe me, it is a game changer for most men struggling with prostate symptoms. The single most disruptive symptom for many is what we doctors call nocturia, that frustrating need to get up and use the bathroom over and over again at night. Every time you get up, your deep sleep cycle is broken. You miss out on restorative REM sleep, and you wake up feeling exhausted, irritable, and drained. This lack of quality sleep creates a vicious cycle, as fatigue and stress can actually make your symptoms feel even worse. By creating a cutoff time for your liquids, you give your body a chance to process them before you go to bed, dramatically reducing the chances of being woken up. If you're really thirsty in the evening, a tiny sip to wet your mouth is okay, but avoid full glasses of water, tea, or anything else. Just implementing these first 2 changes can make a world of difference. Try it for a week, and I promise you'll notice an improvement. Next, we need to talk about one of the biggest culprits when it comes to bladder irritation: caffeine. Caffeine acts as a diuretic, meaning it makes your kidneys produce more urine. But it's also a direct stimulant to the bladder muscle. It makes the bladder twitchy and hyperactive, which worsens the feeling of urgency and frequency. You find caffeine in the obvious places, like coffee, many teas, sodas, and energy drinks. but it can also hide in chocolate and even some pain relievers. If you're used to starting your day with a few cups of coffee, I strongly recommend you switch to a high-quality, decaffeinated version. And try to get out of the habit of loading it with sugar, which is another inflammatory agent. You can use a bit of a natural sweetener if you need to. Your daily limit for caffeine should really be under 200 milligrams, which is roughly 2 small cups of regular coffee. Making this one change can significantly calm your system down. Building on that, let's discuss alcohol and specifically beer. Imagine this scenario. You're out with your friends for the weekend, you have a great time, and you end up drinking, say, 10 beers over the course of an evening. Suddenly, you start having trouble urinating. The stream is weak, and you feel a growing pressure and pain in your lower abdomen. This can escalate quickly to a full-blown medical emergency, where your bladder is completely blocked and you can't urinate at all. The pain becomes unbearable, and you end up in the emergency room. The only solution at that point is for them to insert a catheter up through your urethra to drain the bladder. Trust me when I tell you, it is an incredibly uncomfortable and distressing experience you want to avoid at all costs. Beer is particularly problematic because it's a diuretic, and people tend to drink it in large volumes, completely overwhelming the bladder and prostate's ability to cope. If you want to avoid that painful ER visit, it's time to seriously reduce your consumption of these beverages. Now, let's move into the kitchen. The fifth piece of advice is to significantly increase your intake of dietary fiber. Think of your pelvic area as a crowded neighborhood. Your prostate, bladder, and colon are all close neighbors. When you're constipated, your enlarged, impacted colon physically presses against the already inflamed prostate and the bladder. This added pressure dramatically worsens all your urinary symptoms. To avoid this, you need to ensure you have regular, easy bowel movements. You can do this by eating more fiber-rich foods like fruits with the skin on, apples, pears, leafy green vegetables, spinach, kale, legumes, lentils, beans, and nuts and seeds. A healthy gut is directly linked to a healthier prostate. Just remember, when you increase fiber, you must also drink enough water. Fiber without water can make constipation even worse. This next tip is a simple technique called the double void. It's a method to help ensure you're emptying your bladder as completely as possible. It's very easy to do. When you've finished urinating, instead of zipping up and walking away, just stay there. Relax for about 30 seconds to a minute. Don't push or strain. Simply wait patiently and see if a second, smaller stream of urine comes out spontaneously. By doing this, you help get rid of that residual urine that often stays behind. This is important not only because it reduces the feeling of fullness, but also because stagnant urine left in the bladder can be a breeding ground for bacteria, increasing your risk of painful urinary tract infections, which are a common complication of advanced BPH. And this leads me to a topic that might feel a little unusual to talk about: the difference between urinating while sitting versus standing. I know, for most men, standing is the default, but there's compelling evidence that sitting down to urinate can offer real benefits, especially for men with an enlarged prostate. When you sit, your pelvic floor and thigh muscles are more relaxed. This relaxation allows the bladder to empty more completely and with less effort. It works in perfect harmony with the double voiding technique. While it may not directly shrink your prostate, it significantly improves the symptoms by promoting better bladder emptying. There's also a growing body of scientific thought suggesting that if young men adopt this habit early in life, it may help reduce their chances of developing severe prostate problems down the road. Plus, as an added bonus, it's far more hygienic for your bathroom and the people you live with. Okay, for those of you who have stuck with me all the way to the end, or maybe you just skipped ahead, either way, I'm going to give you the gift I promised. Here are 4 of the most effective natural remedies that you can start exploring to help reduce that prostate inflammation. First, we have saw palmetto extract. This is probably the most well-known and researched herb for prostate health. Its benefits are thought to come from its anti-estrogenic properties and its ability to inhibit an enzyme involved in prostate growth. In fact, many prescription medications for BPH are based on this same mechanism of action. Second is tomato, but more specifically, the compound within it called lycopene. Lycopene is a powerhouse antioxidant that is fantastic for combating inflammation throughout the body, and especially in the prostate. Interestingly, cooking tomatoes like in a tomato sauce or paste actually makes the lycopene more bioavailable for your body to absorb. So a glass of tomato juice is good, but a warm tomato soup or sauce is even better. Third are capsules of nettle, specifically nettle root. Nettle contains compounds called flavonoids that are known to decrease inflammation in the prostate gland. It's also believed to help regulate testosterone levels, which plays a role in prostate health. You'll often find it combined with saw palmetto in prostate support supplements. And finally, don't overlook the humble pumpkin seed. These little seeds are packed with anti-inflammatory and antioxidant properties. But their real superpower for the prostate is their incredibly high zinc content. Zinc is an essential mineral for prostate function, and men with prostate issues are often found to be deficient. Snacking on a handful of raw pumpkin seeds each day is an easy and effective way to boost your levels. If you'd like to learn more about the specific preparations and dosages for these remedies, you can find a link with more details in the description below. Before we finish, I want to leave you with one final, crucial thought. Managing your prostate health is a journey, not a sprint. These lifestyle changes and natural remedies are powerful, but they work best when applied consistently over time. It's also vital to manage your stress levels. High stress and anxiety cause you to tense your pelvic floor muscles, which can squeeze the urethra and make symptoms much worse. Simple practices like daily walks, deep breathing exercises, or even just 5 minutes of quiet meditation can have a profound positive impact. Most importantly, please remember that this advice is meant to complement, not replace, the guidance of your doctor. It is essential to keep your medical team in the loop with any changes you're making. These strategies can empower you to actively participate in your own health, but they work best as part of a comprehensive plan. You are not powerless in this situation. By making these informed, proactive choices, you are taking the first, most important step towards feeling better and taking back control of your life. Thank you for your time, and I wish you the very best on your path to wellness.